Minister, no one could say other than that this bill is welcome. But there are some concerns I'd like to raise, and so that we safeguard the success of its implementation for all concerned. The bill in providing what is free GP care for under 13s on a phased basis, but I'd like to add a note of caution in relation to that and its introduction date and the phasing in and the balance of availability of services. The issue of availability of GP services is one of grave concern, and particularly in Wexford. Evidence-based Trinity College research showed that an increase of 28% in GP visits occurred with the introduction of free GP care for the under 6s. And the reaction by yourself as spokesperson for the opposition at the time was, and I quote, that this is a crisis. Doctors have been treated with contempt since Fine Gael came into power. It's about time there was meaningful engagement with GPs. Now, I don't say that to put you in a position of throwing what you've made as a statement back in your face. I say that because the situation has not changed. And I appreciate that that was then and this is now. But as I said, that's the reality of why I'm reminding you. If you've moved from one part of the country to another in Wexford, which many have, and I have many now constituents coming into my office saying that they cannot get a GP to take them on. Now, it's not the patient's fault, it's not the GP's fault, but it is the fault. It is a fault and it's a fact, and we must deal with it as a matter of urgency. In Wexford, people are actually travelling back to Dublin in order just to get their prescription on a weekly basis. The average number of patients per GP in Wexford is 1,118 per practice. The national average is 861. So we in Wexford have over 30% above the national average for most of our GP practices. The most concerning part of not being able to find a GP is that to take you on is that nobody is actually responsible for gathering this information. So we don't actually have data for those who need a private GP. We do not know what the numbers are. And I think that if we're constructing any form of legislation, we must have all of the data. So I'd like to see possibly a question in the census of the next census that would address that issue. GP practices are under huge strain and they're struggling to give the current patient list and care attention that's required because of the increases. And for them, and in order for them to maintain their level of services, they have no choice but to close lists, as they call it, and take on no new patients. Their staff are under huge pressure to deal with patients requiring medical care when delivering the news that they can't have an appointment inside of 2 weeks, which once upon a time would have been seen as outrageous. But GP practice staff would otherwise be enjoying their jobs if it wasn't for the constant firefighting, telling sick people that they can't have a timely appointment. And lack of new replacement GPs means doctors can't retire from their practices. There's a serious shortage of locums available in the event that a doctor can't attend on his own practice, and the state should consider a pool of locums under the HSE to assist in this regard, which is something that the NHS carries out in their country as a model. If COVID has taught us anything, it's that this is a necessity, and I'd encourage the Minister to get this underway as soon as possible. We can't deliver legislation that looks like window dressing from one area that looks very much like window dressing for me is the doctor-only GP card provided to over 70s who are not entitled to the full medical card. This vulnerable category, in order for them, although they have a free GP card, they are unable to access public health nurse services. And at the age of 70, Minister, I'm sure you and all of us here can appreciate that they are in a vulnerable category. If they only have to have dressings changed once a week, it is much better that that is done by the competent public health nurse than having to visit a GP, and possibly, it should be absolutely considered that it's expanded, because that, for me, eligibility is based on need as opposed to age. So, in 2018, the Irish Patients Association stated that 1,310 new GPs would be required to keep pace with the expected rise in consultations from the implementation of this legislation, and when it was about under 6s. So in having that information, I'm not sure, and I've tried to find in my research where we are at with implementing or where we're at with furthering our GP services and how many have qualified, how many are in training, because on the phased basis of this plant under 12s, we're going to need a considerable increase in GPs rather than experiencing what's already an overwhelmed service and continued crisis. We can't continue in that vein. So the idea in healthcare is that patients receive the care they need, and a doctor's primary focus is to deliver the care that's delivered and delivered timely and of high quality as much as possible for healthy outcomes. Minister, I particularly want to mention something that has already been brought up to you today, but it is about the cut to disability services. 20 million was cut from the disability budget a year after we joined the UN Convention on Human Rights for People with Disability, when we adapted it. I visited the CUMMUS Centre in New Ross. Now, CUMMUS means ability and capability. And whilst it's a disability service, they never once used that word. I was in awe of how they conducted their services during COVID. They never missed 1 hour of support to their residents. They never used the word disability. Their service is about providing supports to enable the ability that their residents and clients have. And I was just full of admiration. And I think, they provide a support that gives these individuals the choice that they want to make in how life and what life has to offer for them. And I was just really, really saddened that the 1% cut, that's called an efficiency cut through the HSE, is going to be from January. And you yourself at that time said that that just couldn't happen. And I am pleading with you, do not cut funding for the most. It's unbelievable what these people do. And they do it on all our behalves. And I'm asking you, do not give them a cut in funding that will inhibit the success that they have. That is paramount to what we provide through disability services. The other thing is that certainly, it's been brought up today as well, home care services. Wexford does not have and badly needs to be placed on the community intervention team services. It is virtually in every part of the country, but not in Wexford. And we need it, particularly because our GPs are overwhelmed. And the CIT Community Intervention Team provides services enhancing overall primary care, providing access to nursing and home care supports from 8 o'clock in the morning to 9 o'clock at night, 7 days a week. But Wexford GPs cannot refer anybody because we don't have it in Wexford. So again, we have home care hours that can't be provided unless somebody dies. I'm ashamed to make that statement in this day and age. It cannot be that we're providing, on one hand, an eligibility criteria that's not based on need, when we have a huge need that's based on somebody dying to provide the service. So, again, Minister, I know that you're new in the job, but I know that you have already addressed these issues over the years in opposition, and I'm asking you to continue in that vein in your position. And last but not least, as I said, I want to commend all of the frontline workers in Wexford, many of whom are not just in the medical care section. Our public health nurses, our public health service, our home care workers, everybody that has provided services throughout the COVID crisis and that continues to do so. And in that, Minister, I hope that you will, as part of the Cabinet, fight to ensure that the promised increase in their wages is honoured when the time comes. Thank you.
Thank you.